Hi, everyone. Welcome back to the Clinical Leadership Podcast. I'm your host, Dr. Alex Earl, and I'm joined today by Dr. Robert Silverman. Dr. Robert, how are you doing today?
I'm doing great, my friend. I am doing great. How are you?
I'm doing well. I'm doing well. Yeah, we got a lot to talk about, a lot of things to discuss. I'm excited to have you on. We've got Noah and Lauren Emmanuel in our business mastermind group, and they're like, hey, you got to have Rob on. He's a wealth of knowledge. He's an eccentric guy. He's fun, and we just think you two would hit it off with an episode. And I thought Robert Silverman. I met him at the Florida Chiropractic Association
Great.
so many years ago, and I
Wow.
thought, you know what? And you shared, this is random, but you shared your contact info with me. It got saved in my phone, and every year I get a reminder that it's your birthday. I don't know how that happened in my contacts, but every day on your birthday, I get a notification that it's your birthday. But we go way back. I'm glad that we're able to connect. And I'm glad that Lauren and Noah were kind enough to say, hey, you two like-minded people, we got to get you on the podcast for an episode. So, Rob, thank you for joining me today.
Thanks for having me. And Noah and Lauren are absolute superstars in the chiropractic realm. They're good personal friends. And by the time we're done with my career, without question, they're going to light the world on fire.
Oh yeah, they are. They're great people. I've gotten to know them over the last year and a half. Year and a half since one of the classes that they attended, and I could just tell, like they're just different. You know, you can just tell people that are unapologetically getting out into their community, impacting their community for
Great.
not just for chiropractic care, but just for the betterment of the community itself. So yeah, we love them. We do. They're good people. But anyways, we want to talk more about your background. We want our listeners who might specialize in the functional rehab model. They might have a clinic gym hybrid model. And they might view a lot of chiropractic rehab and soft tissue techniques. This is where we need a little bit of a reality check, in my opinion, because the biopsychosocial model is something that we do preach and teach in our courses. However, I do think that what we're about to share with us is a little bit more, I think it's a little underappreciated and it's overlooked. So tell us a little bit of your clinical background, your training, and who your ideal and who your patient base that you're currently treating is.
Oh, great. I have about 25 years of clinical practice. I went to the University of Bridgeport College of Chiropractic. I'm a Northeast guy. I mix sports injuries, low-level laser therapy, rehab with a functional medicine override. I love the philosophy of functional medicine, functional nutrition, in that it's to get to root cause resolution. I think it works in concert with the chiropractic armamentarium and chiropractic rehab. Patients I see are an interesting array of people. As I was telling you before, I had someone just come down and drive 4 hours to come see me. They're coming down with some neurodegenerative diseases. It looks like early onset Parkinson's. Do a lot of work with the gut, because the gut is the epicenter of your health. 80% of your immune cells are in your gut. It's where your macro and micronutrients are absorbed. A lot of gut to brain axis, which I like to refer to as the superhighway to health, and an override of sports injuries and sports performance. You know, it's funny that you bring up what is my avatar. And I always say my avatar always starts with someone that has a spine, it has a gut. I keep the brain out because I'm not so sure that may be asking too much sometimes. It's my little way of light humor. However, my avatar is somebody who's really interested in health, who's relatively educated, that values making a change and sharing their information, not for themselves, but with their friends, their family, and anybody else beyond that.
Excellent, excellent. And you're currently practicing in the Northeast, you said. Where are you located?
I'm right outside New York City. I'm about 25 minutes outside New York City. I'm in Hartsdale in Westchester County, which is just like 2 blocks from White Plains, which is the center part of Westchester County. I grew up in New York City. I grew up in the Bronx. I'm now in the first suburb. So I've basically lived in New York my whole life, other than the 4 years that I went to chiropractic school in Connecticut, which is only 45 minutes from where I am now. So yes, if I have a New York accent, I apologize.
Oh, you shouldn't apologize for that. But I do want to talk a little bit about your journey, right? Like coming out of school, did you jump right into functional medicine? Were you, more of like a traditional chiropractor with rehab, approaches? Talk a little bit about your journey on how you've ultimately landed where you're at right now with this functional medicine model.
We were talking about it a little before we went on. I went to what they call a metapractor school.
Yeah.
So we got exposed to soft tissue. We had one or two nutrition classes. I got exposed to exercise rehab. Remember, I graduated in 99, so there was a lot different material that was available to chiropractors. So I started as a chiropractor who wanted to learn. It's interesting that they used to ask me that I was the why guy. Well, what else could we do? Why does that work? How does that work? So
Yeah.
then I started to integrate active release, Graston at the time. I've since evolved to Factor. And I was interested in nutrition because I thought nutrition was without question the biochemical add to the body. It answered that question. Uh, to get into functional medicine, it was about 22 years ago. I went to a seminar. I remember it distinctly. It was Metagenics. And there was the father of functional medicine, Dr. Jeffrey Bland. And there he glowed. And he talked about this is how we have to look at the body from the inside out. And man, I was smitten. It was fabulous just to think about what we could do with testing, supplements, the change in diet. It was a wow factor. And to have him write my forward of my most recent book, Immune Reboot, 2 years ago, it was sort of a little bit of a surreal moment. So I'm a big proponent for people who are just coming out of school. Add one thing at a time. Don't
Sure.
add like 18 different things. I mean, I think you'll agree with that. You add the one thing at a time. Get your 10,000 hours in adjusting if you're a chiropractor. Get your 10,000 hours in having muscles melt on their hand with some soft tissue technique. Get your 10,000 hours understanding rehab and, ipsilateral cerebellum, opposite side cortex, etc. Put your time under tension. There's so many people that, and I got a lot of degrees, they all just ran and got the degree, but it didn't translate into outcome because they didn't master it. And if I had to say any one thing that any new person needs to master, or two things, one, it would be the ability to communicate. Because I
Hmm.
think, remember, patient care is patient management, which is people management. And I think they need people like you who can explain the modern everyday evolution of how to run a business. My era, everybody said, you put a shingle on the door and people walk in. You and I both know, we were just talking about Instagram, TikTok, Facebook, etc. That's just not how that happens anymore.
Yeah, you're right. We in our one business class that we had in school, and I went to National University in Lombard, Illinois. Our business professor was describing how to get in the white pages, and he was telling us, hey, he said the same thing. All you have to do is get a shingle, put it out in front. And I'm thinking to myself, it's 2014 at the time. I graduated in 2015. I'm not putting a shingle out, like I'm just not doing that, where I could get an Instagram page going and I could get 25,000 people to watch a reel in the next, 7 to 10 days. That reach,
Right.
is far greater than, any shingle or any ad in a white page or yellow pages. So yeah, you get it. You get it. And your Instagram game is strong. I gotta say, Rob, you're almost at what, 57,000 followers on Instagram,
Yeah.
which is awesome. We love to see it. Yeah, and well, we're going to talk about social media in a second here, but one question I wanted to ask you is, you kind of mentioned the advice to new grads. What advice would you give someone like me who's been out for nearly a decade, and I'm starting to question a lot of the rehab techniques because I think we do need to add more into the biopsychosocial model, and nutrition is a key component. I love what you said about, gut brain axis, and gut immune axis. I love all that stuff. I just spent so much time, right? There's an opportunity cost. If I spend a lot of time learning Yanda, learning Kolash, learning all the DNS principles, well, then that was time spent away from learning other nutrition pathways and supplements and getting some clinical excellence from a nutritional standpoint. So, what advice would you give someone like me, just about 10 years in?
That's such a great question. And it's a conversation I have with a lot of rehab specialists, in that you're right. You spend a lot of time learning some great information, resets, um, upregulation, core activation, proprioception, contralateral movement and crawling, etc. But the question is, how do you help along? How do you adjuvant with nutrition? And that's really a great question. So what are you doing to save the whole process? So the basis of rehab is to retrain the brain and engram the brain to have a better end result. So how do you press that store button? One of the ways I believe pressing the store button in the brain is feeding the brain with its needed nutrients. So specific needed nutrients like omega-3 fatty acids, vitamin D, taking care of the gut, which communicates with the brain with the pre and probiotic, specific magnesiums like magnesium L-threonate, making the brain more vibrant, making neuroplasticity a reality. I think that the rehab is one hand and the nutrition to allow the body to function is another. And also when you think about rehab, rehab's basis is to decrease inflammation. Well, obviously, if we watch certain foods, decrease your sugar, decrease specific man-made carbohydrates, also use something like a pro-resolving mediator, PEA, boswellia, turmeric, and the like, you're able to decrease certain inflammatory pathways. It's going to work very synergistically with your rehab. And I think that nutrition is the next step after rehab. And it's so great to have this conversation because it looks like a dartboard, but really these all come together to make the bullseye of health if you can all utilize them and pin from them. And like we said before, it takes time. You have to spend a certain amount of time on your adjustments, on your rehab, on your soft tissue, on your nutrition. And that's why I like what you're doing. You're trying to get a lot of great minds in rehab from different parts of the universe to come together to have a specific landing spot. And I know you want to talk about that and let everybody know where we can all meet together. I think that's in July, at the end of July. You're going to give the exact date, July 28th, if my memory serves correct.
The Midwest Pain Summit, July 27th and 28th. I'm excited to announce that you will be one of our speakers talking on this exact topic on the theme of the weekend is athletes in pain, how we can improve on, get this, Rob, you ready? Communication, because athletes are wired, if you know, just a little bit differently. But also there's a team of people, especially if you work with a pro team or a college, or if you work directly with a high achiever, it does require a little bit of a different communication game. So I'll be talking on communication. It's funny you said that earlier about communication. I could teach a class and it would be entitled "How to Improve Your Communication." Nobody would sign up. And then I teach a class, dynamic certification of fascial whatever you want to call it. And people, ooh, that sounds interesting. I'm going to sign up. Meanwhile, the thing that we know that has a tremendous value to your patient care is communication, education and communication. It's a soft skill. And I'm going to be talking about that. You're going to be talking about this nutraceutical world, especially some popular topics. We will address myths. We will address things that are actually backed by the literature, because what we're seeing now is patients are asking us these questions in the rehab world, and we want to equip the functional rehab chiros in your lecture, in your talk, on how to best approach those, how to even provide things in their office, or how to answer questions that are just patently not true, and to be courageous and be able to tell the truth and to speak into those. So tell us a little bit more about treating athletes nutraceutically, and also we're going to talk about peptides. I mean, that's going to be one of the most frequently asked questions in our seminars and in our patient care, has to do with this emerging trend of peptides. So take it from there.
Yeah, peptides are hot, man. So I'm going to table that for a second and talk a little bit how to treat athletes. We take a few things for granted with an athlete. For instance, we never realize that over 2 hours of exercise really can be very detrimental to one's overall gut health. Now, most athletes, 2 hours, that's their warm-up. Let's be real. So every athlete, you would want to assess their gut, maybe do a gut barrier test. But more so than that, people always ask for a recipe. Can I have a protocol? And that's fine. That's a starting point. But when you think about it, are you going to treat every athlete in every phase of care the same way, but all sexes, etc.? No. So I like to break things up into very simplistically 3 phases of care. I like the acute phase, the subacute phase, and what I like to refer to as the performance and wellness phase, with them all being above the chronic phase. So acute injury, you would look at acute injury, kind of like a sprained ankle, if you will. Somebody sprains their ankle, it swells up, it gets red. That acute phase is the first 3 to 5 days. So you're going to treat that nutraceutically, vastly different than you would a subacute phase, which is more from like day 4 or 5 up to including week 8. What's interesting about the subacute phase is repair and remodeling of the tissue occurs. So everybody stop right there. Here's a clinical gem. Most patients, most athletes don't typically come in initially. They just don't. They want to wait to see if it goes away. And I always ask them, does your injury have a passport? Where's it going? Is it going north, south, east, or west, intercontinental? Where is it going? And they need to know that that injury needs to get addressed pronto, because you don't want to start a subacute injury or start treating it with a subacute injury because of that repair and remodeling phase, and some scar tissue may have already laid down. So hopefully you get them in the acute phase. You walk them through the subacute phase and you get them into the performance and wellness phase. So in this proverbial ankle sprain, you're going to have a distinctly different nutritional input in the acute versus subacute, as opposed to the wellness and performance. Now, when you look at chronic, now chronic is vastly different. Now, of course, chronic is something that's someone's had an injury for 3 months, and it really should be jacked up over 6 months. So now you're dealing with somebody with fibrosis, scar tissue, gait pattern dysfunction, etc. And then when you look at the nutrition, obviously it's going to be vastly different than the other 3 or 4 mentioned phases. In addition, women are going to respond differently to certain nutrients than men respond to certain nutrients. Now, are we talking about a power athlete, an endurance athlete? Are we talking about CrossFit, which is the greatest mix of power and endurance athletes that I've seen? I mean, it depends on the WOD. So all that being said, you really need to delve into the different phase of care, the sex of the patient, and what kind of sport. For instance, I had a pro athlete come in, and he was a basketball player. And I got a call from the athletic trainer performing all the rehab. And he said to me, Rob, you need to talk to him. He's not getting me. I'm like, look, you're a lot younger than I am. He looks at me as his dad. He looks at you as like, you know, his contemporary. And truly, I asked the basketball athlete this question: are you power or are you an endurance athlete? He thought he was an endurance athlete. Now, being a Division II walk-on basketball player, I can't tell the guy I played basketball, because he's going to laugh, and he's going to laugh loud and hard. Within that, I gave him certain scenarios to allow him to understand that he's more of a power athlete. So 1, obviously, his training needs to be more power-oriented, and 2, his nutrition needs to be more power-oriented as well. So that's kind of like a framework when you look at an athlete, male, female, what kind of athlete? What fibers are they going to isolate, and where are they in the different phases of care?
I love it. I think I'd go one step further with you, because one of the areas in the rehab model, I love that we can have this kind of back and forth too, because I'm seeing and understanding from your perspective in your world, and it just makes sense. It really does. And from my vantage point, my lens that I see this through as well is the propensity to treat as long as pain is present. And then as soon as we have eradicated pain, then, oh, hey, the functional rehab model worked, and now you're discharged. Come back when you need me. And I think we're vastly undertreating our patients because of what you mentioned earlier, that tissue healing time frame. The tissue is still healing, even though the pain pressure threshold has been subsided. So it's interesting that we discharge patients even though they're still going through active tissue recovery. I love what you said about tissue remodeling and repair. It's super important to know these tissue healing timelines, because that's how you can best advise your patient on the road to recovery. So let's talk about the early stage real quick. I'm gonna put you on the spot. Patients
Sure.
comes into you with that lateral ankle sprain, massive swelling. What are some maybe 1, 2, or 3 supplements or nutraceuticals you'd recommend they take within that the first 3 to 5 days?
Proteolytic enzymes taken before the food are a great choice. I love proteolytic enzymes. You also could take some boswellia,
Sure.
some turmeric, because you want to modify the inflammation. Inflammation is fine, but the problem is that if the inflammation goes too high, it kind of damages the area and it stays too long. It now becomes chronic. So there is a modification of inflammation at the beginning. There is a modification of helping remove the cellular debris away. Also, is that athlete, I'm going to give you one back, is that athlete an intermittent faster? Because if they're an intermittent faster, they have the ability to perform autophagy and mitophagy and essentially clean out dead cells or damaged cells a little quicker. You may want to use something like a spermidine, an alpha lipoic acid that helps with the intermittent fasting cycle. So that's a really good question. Now, also, and I'm not trying to go off on a tangent.
Go ahead. Hey,
I'm going to seed you.
This is why we're doing this. This is why we're here. Yeah.
Is it a woman? Because women, especially women athletes of, say, 15 to 50 menstruating years, do not respond to intermittent fasting the same way as men do. So you have to take that into account. So I guess I said it. I dropped the bomb. Let me make sure that we don't have any fallout from the bomb. So essentially, women of menstruating age brackets don't respond as well to stress or hormesis. Intermittent fasting is a form of hormesis. So women in that age bracket, when progesterone goes high, so as we all know, there's a 28 to 32 day cycle that a woman goes through. In the second half of their cycle, estrogen drops, progesterone pokes up. When progesterone pokes up, progesterone is very sensitive to stressors of the body. If you stress a woman, progesterone drops. You put them in PMS, and every woman, man alike, knows that's chaos and mayhem. That said, you probably can still intermittent fast, but you need to close the window of fasting down a little bit. So if a woman's 14 to 16 hours into her fast, normally in that last 7 to 10 days of their intermittent fast, you would probably knock them down to about a 12-hour window. So I kind of like answered your question and I took it for a ride somewhere else. I'm sorry about that.
Oh, don't apologize. I think these clinical gems, I think that's why we're here. I think people want a good reminder. To be honest, you and I were a friendly reminder service. That's one of the things that we are. Even your mention of proteolytic enzymes, I remember that, but a long time ago. So
Still
even
works.
how quick still works, I remember that for the acute stage. And again, I had to take, this podcast for you to remind me of the proteolytic enzyme. So already that's one of my takeaways from today's episode. But no, this is awesome. I love this conversation. I think people are starving, not just for, slides on a screen. They're like, Boswellia is great for this and that, and here's the dose. That's all good and helpful information. But I think what people are starving for is that clinical application, kind of like me putting you on the spot. Lateral ankle sprain. What can we do the first 3 to 4 days? I think people, again, I like what you said earlier, that we can give recipes, we can issue, cookie cutter treatment plans, and that will get 60, 70, maybe 80% of the people on the path to wellness or recovery. But there's going to be drop-offs. There's going to be people that need that individualized touch. So talk to me a little bit about your, I guess your treatment. What does a treatment session look like with you? Just patient comes in with that lateral ankle sprain. Walk me through what that looks like. What rehab do you do? What, how the education goes, even role play if you want, so that people can kind of hear you deliver it. Cause I think that's even a script is almost like a recipe, but even hearing you communicate in your style, I think people get a lot of value out of that. If I can put you on the spot again.
Yeah, put me on the spot. I love it. So with the
Yeah.
lateral ankle sprain, of course, the first thing I'm going to tell everybody, especially new docs, is get a full-fledged assessment. Let the patient know what you're doing because you're touching them. Let them know what you're looking for. Let them know what your working diagnosis is. Then, of course, you put together a treatment plan. Some people like to adjust early at a lateral ankle sprain. I agree with that. Some people don't. Okay, so be it. You want to modify and modulate inflammation. That's like my mantra. I always want to do that because, inflammation is fire, as we all know, set a fire. We want to utilize that fire to allow the body to heal. We don't want to shut it off. We don't want it to get too high, and we don't want it to last too long. So certain things that I would do at that point is I do use ice. I know that's a huge argument, and my God, we just lit up the boards. If this was live, it's heat, it's ice, it's heat, it's ice. Guys, gals, pick your poison, if you will. I'm going to go with ice for now. But that said, my big is I am a low-level laser guy. I will fight on a hill for a non-thermal laser. I want my lasers to be a class 1 or especially a class 2. I want a laser specific area. Why? Because I want photonic energy to allow for electromagnetic transfer of energy to stimulate mitochondrial function and allows the cells to heal and communicate from the inside out. There's been more game-changing effects in my office since applying low-level laser than any other technique I've used, and it's as simple as pressing a button and pointing. Now, of course, I don't just point and shoot with a laser. I use a myriad of different approaches, movement, neuro rehab, neuro resets. But if you just want to press and play, that's a great modality. I do like soft tissue mobilization. I'm a factor guy, good friends with Dr. Todd Riddle. Love it. I found that mechanical vibration. But again, here comes the board. It's going to light up. I don't like to bruise when I use any kind of instrument-assisted soft tissue. Guys, it's already inflamed. Why are you inflaming it anymore? It doesn't make sense to me. It makes sense to get a lot of extra blood flow if it's torn. If there's a tear and it's still attached, I want to get that fascial vibration and start getting that chemical and neurological feedback to stimulate healing. That's just me. And there's another reason why when we talk about inflammation and using some of these soft tissue techniques that you want to be able to use nutrition, again, because you want to manage and modulate that inflammation. I like rehab right away. I mean, if they can put a little pressure on it, let's start rehabbing. Let's start smalling the foot. That's what we called it when we learned it in school. I think there's a couple other now funky names for it, but let's start smalling the foot. Let's start getting some proprioceptive feed. Let's start getting a range of motion. Let's start doing some band work. So that would be my initial thing. Also, check that gait because, well, number one, lateral ankle sprains, no, I think they're the number one sports injuries and they're the highest reoccurrence because most people don't do exactly what you do every day in your office, which is rehab. And number two, that ipsilateral glute shuts off because they never get hip extension. So hence, start, even if you can't get hip extension walking, get them prone, start practicing that hip extension. Let's get him moving. Let's get him some glute bridges. So that would be something like day one. Nutrition, they would get 3 to 5 different nutritional things, you know, proteolytic enzymes, omega-3 fatty acids, pro-resolving mediators, the peptide, which we'll talk about a little later, BPC 157, etc.
Anything topical that you would put on it?
I'm in New York, so I have to limit my topical, but I would not have a problem with any kind of topical things if I was in Connecticut using my Connecticut license.
Yeah, we've got a pretty broad. I'm in Tennessee right now, but I'm also licensed in Georgia and Illinois. Illinois is where my main clinic is, and very, very broad. In Illinois and Tennessee, I should say the scope of practice is very similar. Georgia, a little bit more restricting. But in Illinois, for a long time, someone would come in with a real big, swollen ankle, maybe just within an hour or so that they had the injury, and I started putting on ozone, like topical ozone,
Great.
and and then I actually started using it in the home with kids and bumps and bruises and stuff, and I've got this picture of before and after picture of our youngest daughter who climbed up the back of a bar stool and it smacked her in the face, like right under the eye. And then to make matters worse, she let go of the bar stool, fell on her back, and then the bar stool hit her again. So she got two traumatic facial injuries in the span of a few seconds. Well, anyways, her face looked black and blue, and we just started putting topical ozone on. And I mean, within 3 or 4 days, there was a noticeable change of this very, very deep swelling on just the. I mean, I think she was 18 months old. She was not old at all. But yeah, it's I'll have to show you when I see you in person. I'll show you the before and after photos. But that became a game changer for me when I see that someone has the potential for that that edema that, that might pool into the heel, especially if we're talking about the lateral ankle sprains, I'm immediately thinking we could put some topical ozone on here too to help with that inflammation. Because I like what you said earlier, that inflammation is just a part of the healing process. So we don't necessarily want to eradicate it as quickly as possible, because it does stimulate some of those regenerative tissues, because there's been a trauma, there's been an injury that took place. So no, I love it. I love it. It's a good 1-2 punch. You get the movement, you get the nutraceutical take, you get the chemical take. I like it. I like it a lot. So let's pivot over to the pain summit, 'cause I do want to touch base on this, because this is the topic. We're going to talk about this, during your slot. We're going to absolutely make sure we touch base on this and leave some plenty of time for Q&A with you at the event. Based on what we're discussing today, and based on what you've kind of hinted we're going to talk about, who do you think would really benefit from coming to hear you talk at the Pain Summit next month?
Anybody who's interested in modulating pain, anybody who's interested that has patients that have some pain. So, the associated colleagues would be chiropractors, of course, naturopaths, physical therapists, athletic trainers, doctors of osteopathy, even an orthopedist. I mean, orthopedists are now becoming more and more integrated. They have pain clinics, physiatrists, because they're always looking for alternatives. And I think any one of them would be a great choice. And anybody who has an injury on their own, it's an interesting thing that if you were to ask somebody standing next to you, say, do you have any pain? Do you have any back pain? We all know that 8 out of 10 Americans at some point have lower back pain. 1/3 of Americans sprain their ankle. So if you would ask a person next to you, they're probably in pain, and their answer to pain is non-steroid anti-inflammatories, Tylenol, and prescription medication. We are 4.4% of the, well, actually 4.24% of the world's population. We use 80% of the world's pain medication. I would say virtually everybody should be at your pain summit when you look at those numbers.
Wow. When you put it in that context, that's pretty startling. That's pretty startling, to say the least. Wow. Yeah, and we definitely want people that are interested and curious about different pain classifications. We're talking about more speakers that are going to be coming down the pike as we announce them. But you're going to really enjoy the weekend, and I hope that it is an annual event. No, I don't hope it is. It's going to be an annual event, and we plan to film the event as well, so it can be in like a video library, so people can always come back and watch and listen to the clinical gems, and just the just the wealth of information at the events. I can't wait for people to experience it. But my favorite part that I'm looking forward to is the breaks, in between the breaks, and the dinners in between, and the, I don't know, the connection in the community of the group. That is always where I've always had a surge of adrenaline and a surge of excitement, is at the break, getting to talk to people, getting to connect, getting to meet people that I haven't met before. And that's the other aspect of the Pain Summit, is to get people into a room again, in this post-COVID era, where we're actually starving for that human connection. And you know what? I do say this to people in our coaching world. Very few people understand what we do. Family, friends, it can be very difficult to communicate to them what we do. But when you get into a room with like-minded professionals who understand you, who know you, who like you and trust you, there's a ton of breakthroughs that can happen, and there's a ton of connectivity. And that's the point, is to just get the creative juices flowing by getting like-minded people in the same room. So we're glad to have you on board. We're super excited. Any closing comments, any closing remarks? Oh, how can people reach out to you? How can they, follow you on the interwebs? Tell us how we can get in touch with you.
Thank you for my ability to give a shameless plug.
Please
Any of
do.
my social media, Dr. Robert Silverman. My website is drrobertsilverman.com. Feel free to reach out. Any questions, anything that I can do to be a service to you, I'm here. I believe in a collaborative effect. That's why Dr. Alex and I are able to get on today and have a conversation. We just want to enrich everybody. And, I always like to end with a quote. As Jim Rome once said, take care of your body. It's the only place you have to live.
Excellent. Appreciate it, Dr. Rob. Thank you for coming on today.
Thank you.